So today we're going to do some ultrasound on a 26-year-old female who has 2 children. She's been complaining of chronic low back pain for about 2 years. She's tender in the area, she kind of hurts when she bends over. So with it being kind of more of a chronic and less acute, we can actually use thermal ultrasound to also heat up the tissue as well as get the ultrasound effects. Some of the contraindications specifically for this patient that we want to be sensitive to is if she has some like decreased sensation in the area, if she has any circulatory issues that she knows of, if she has any active cancer, and then also with being a female, we want to make sure that she's not pregnant. And also with it being on her low back, that's another kind of area of concern for that. So, how you doing?
Doing well.
Bonnie?
Doing well.
So I'm just gonna reiterate some of the contraindications that we have for this treatment that we're gonna be doing today, okay?
Okay.
So I'm gonna check your sensation. I just want you to let me know whether or not you can feel me touching your back. Yep. Okay. Do you have any circulatory issues or like you have decreased blood flow or anything?
Nope.
Okay. Are you pregnant that you know of?
Nope.
Okay. And then also, do you know whether or not you have like any active cancer going on at the moment?
Nope.
Okay. So we double check with our patient that we don't have any other contraindications going on. So we'll go ahead and set this up. Because we're going to be hitting a little bit deeper muscles, we're actually going to use 1 megahertz. It's already on that. I'd already turned sound on. And then, like I said, we're going to use the thermal ultrasound for this patient because it's a more chronic issue, less inflammatory effects to be concerned about. So that'll be on the continuous here. And then we'll just get some of the gel on her here. It's gonna be a little bit cold on your low back, okay?
Okay.
Get a little bit on her back, and then I like to put a little bit on the sound head as well, just to make sure we get a decent amount on there. I'm gonna rub some of that in first. And we also want to be cognizant that we're not right over the spinal cord either, because that's kind of an area that we want to kind of try to avoid. So we got that spread out. We're going to turn the intensity up because we're hitting that deeper tissue and we're on 1 megahertz. We're going to do 1.5, and we'll do about 5 to 10 minutes. So our effective treatment area, it's about 2 to 3 times the size of our sound head. Sometimes the effective area of the sound head is not the entire sound head, so we're going to try and keep the area to a pretty small radius here. We want to keep slowly moving, keep the sound head moving, make sure we have gel on there. And then we want to make sure that we still have contact when we go to stop, so we don't damage our crystals. And then, well, wipe our tools off, make sure that the area, the skin around the area that you're treating is not damaged or anything. Doesn't look like there's any redness or anything. Okay.